As COVID-19 spreads across the globe, it brings with it the threat of economic collapse. The World Health Organization warning of a second contagion, false information. Around the world, politicians, profiteers and others have sometimes unwittingly, sometimes not unwittingly, transmitted inaccurate information about the virus. In some cases, some misinformation's had tragic results. Maybe few people know it's actually a criminal offence in South Africa to spread disinformation about COVID-19. One of the checking mechanisms that's really come into its own during the pandemic is Africa Check. Kate Wilson is their deputy editor. She joins us now. Kate, good evening to you. How much more disinformation has been pushed out during the pandemic than what we normally see? Are you seeing a lot more false information out there?
So anecdotally, we can definitely say that since February, really, in South Africa, we have seen an enormous increase in the amount and the different type of information that is being spread about COVID-19. Like you say, some of it is true, some of it is false. But we really think that on reflection, possibly in years to come, looking back, we'll have a better idea of the scale. But right now we're in the thick of it, and we're dealing with it as it comes.
Is it possible to quantify how much disinformation there is out there at the moment? And I mean, you can spend 2 minutes on Twitter and you'll probably get to the hundreds of thousands of tweets pretty quickly.
Yes, we all know it's a lot. As fact checkers, we see it on nearly every platform. But to say exactly how much is difficult, and that's for a number of reasons. One of them being that a lot of this information, both correct and incorrect, is being shared on platforms which are away from the public eye. Platforms such as WhatsApp offer people the opportunity to chat and communicate in encrypted messaging, so they have the assurance that their messages are private, and people like that functionality of the platform. But that actually presents quite a big challenge when misinformation and disinformation is being shared on these platforms, because there's no way for the public or fact checkers to see what's being shared and to intervene when dangerous and sometimes deadly information is being passed around.
Who does this sort of thing, Kate? I mean, we see it all the time. Sometimes it's just someone who doesn't really know better, but sometimes it's people who, frankly, I think do know better.
So we see and we can speculate on a number of different motives. We certainly do see people who are intentionally trying to mislead, and there can be a couple of different motives with that. Specifically around COVID-19, we have seen an increase across the continent in disinformation where people are trying to sell or peddle a treatment or a prevention that people can take to protect themselves. And this does have quite real consequences. The worst of those being that if people take a medication or a treatment or a remedy which isn't tested and which isn't safe, they may actually harm themselves, and they could actually be a situation which results in people dying. The other alternative of the situation is that people could take something which isn't going to protect them or cure them of the virus, but they then have this false sense of assurance or confidence that they are protected or they are cured. And then they don't go on to practice really good preventative measures that everyone should be doing, such as hand washing and not getting too close to people who are unwell.
There's also a huge temptation for media organizations, other institutions, to publish what they see, especially, you know, in an era of clickbait. Are we seeing that becoming a rising problem? People are publishing first and checking later?
I think that it is a problem. It's unfortunately nothing new. Africa Check has been fact-checking in South Africa since 2012, and it's something that we've been dealing with over the last 8 years. And certainly media houses, newspapers, websites do really need to put in the extra effort, not just with stories around COVID-19, but with all their stories, to make sure that accurate information is shared, and that the tendency and the pressure to publish first and be first doesn't overpower the importance of the fact that this is a very important public health issue, and that the media and public platforms have a huge responsibility to play a positive role in disseminating accurate information.
Okay.
But I also think that the responsibility also comes to bear on everyone, members of the public, who also can have enormous power to share and to mislead. So we also have to play our own roles individually.